I'm coming from Nicapazıl City Hospital from Kahramanmaraş. I'm here for 9 years. I was there during the earthquake also, uh, and then Azad will continue. As you know, Azad is another artificial intelligence in Turkey, and it allowed us to unite together in this presentation. Our friendship continued back from the days of Marmara University. My main language is English, so I will doing the presentation in English. But if you have any questions, I can answer them in Turkish.
For Turkey, because it is the day that Atatürk declared it as National Sovereignty and Children's Day. At the same time, today is World Infant, Child and Adolescent Day. So we have two holidays at the same time. Now I'm going to talk about deep learning. What is deep learning? I'm going to first introduce you to deep learning. Now, deep learning is a set of algorithms in machine learning that attempt to learn in multiple levels, corresponding to different levels of abstraction. It typically uses artificial neural networks. The levels in these learned statistical models correspond to distinct levels of concepts, where higher level concepts are identified from lower level ones, and the same lower level ones can help to define many higher level ones. So you have a cat there, picture of a cat, then you have a definition of a cat. So you have one going that way and the other one even coming again the other way. What is the difference between artificial intelligence, machine learning, and deep learning? First, you have artificial intelligence, which is any technique that enables computers to mimic human behavior. Machine learning is a sub-level of artificial intelligence, and it has the ability to learn without explicitly being programmed. And what I'm going to talk about today, deep learning, extract patterns from data using neural networks. So what do you have? We have artificial intelligence, then we have the sub-level of machine learning, and then we have deep learning. Okay, first we have again artificial intelligence. Computes to copy human behavior. Then we have AL techniques allowing computers to learn to solve a specific task. And then we have it at the neural level, the neural networks. So what is the difference between artificial intelligence, machine learning, and deep learning? It's the oldest one, started in 1950s, then we have machine learning in the 1960s, and deep learning in the 1970s. Artificial intelligence represents simulate intelligence in machines. Machine learning is a technique for getting machines to make decisions without being programmed. Deep learning is the process of using artificial neural networks to solve complex problems. The aim of AI is to build machines that are capable of thinking like humans. Machine learning is a subset of artificial intelligence, and deep learning is a subset of machine learning. Deep learning uses neural networks. Let's try and remember this. So here we have it again, machine learning, manual extraction, minimal human intervention, supervised reinforcement learning, autoencoders and generative adversarial networks, diverse models, interconnected neurons, relies on structured data, leverages artificial neural networks, distributed across a server cluster, reliance on data sets. Şimdi burada artificial intelligence, sonrası ne geliyor? Machine learning, sonra ne geliyor? Deep learning.
There is our machine learning, artificial intelligence, machine learning, and then deep learning. What is the difference? Big data, multiple data. They use multiple data. And here you see another example, machine learning. We need human, they do classification, but here the person we destroy the person here, they don't need any human at all. We do feature extraction and classification totally, and to achieve the big data. And then what does that mean? The the need for loads, the load of work is eliminated. So here are the outputs. What we are talking about, the neural networks that we use: perception, feed-forward, radial basis network, deep feed-forward, recurrent neural network, long short-term memory, LSTM, gated recurrent autoencoder. There's etc. There's so many of them.
Some networks are more important than others. Again, what does it use? CNN-based, AlexNet, Clarify, CPP, VGG, GoogleNet, RBM-based, autoencoder-based, and sparse coding. Belki burada duyuyorsunuz. Derin.
Yes, you see here deep learning or AlexNet or ClassNet CPP. Uh, Actually, these are some of the most that are used. PK.
In the health system. So what do we have here? We have the digital knowledge base, and then we have, sorry, this is different. So we have artificial intelligence analysis, then we have synthesis, and what does the synthesis? Deep learning. And then we have the data, adding it to clinical decision, with discussion, and finally, we get the answer. Aslında ne yapıyor? Birleştiriyor. Deep learning hepsi birleştiriyor. O zaman işimizi
So deep learning combines everything, facilitates our task, but the data should be big. It should be multiple to get much better result. So
mental health outcome research, a scoping review. Most of these studies on artificial intelligence, especially deep learning and machine learning, are done by Chinese. Amazing stuff on the internet, and this is one of those studies actually, and this reviews the literature relevant to DL applications in mental health and categorizes these relevant articles into 4 groups: diagnosis and prognosis based on clinical data, analysis of genetics and genomics data for understanding mental health conditions, vocal and visual expression, data analysis for disease detection, and estimation of risk of mental illness using social media data. Finally, we discuss challenges in using DL algorithms to improve our understanding of mental health conditions and suggest several promising directions for the applications in mental health diagnosis. Tıklayabilir miyiz bunu? Direkt tıklarsanız açılıyor zaten. Tablo var aşağıya. Şu tablo görebiliyor muyuz? Tamam. Bu tablo. Cookies kabul edelim.
So this is the table. So now here.
Multiple places, deep learning. Multiple deep learning. And what is important here is, in fact, the accuracy is greater for neuroimaging studies, for schizophrenia, and then for the ADHD. Şimdi daha sonra bunu özetleyeceğim ama bunu söylemek istiyorum.
I'll be giving a summary, but this deep learning is research the least because the data comes the latest for deep learning, but the researches whose significance comes correctly is on for schizophrenia, etc. But for schizophrenia, by trying to put the diagnosis, the deep learning gives something very valuable. It gives the topography of the brain, the anatomy. The anatomy of the brain also gives information. It means that deep learning is just a statistics or is not only a mode or statistic, but also is at the same time provides information about a network inside the organs that we don't know yet. It explains the topography, and it's very important. And so
Diagnosis of physical conditions can be based on lab tests. Diagnosis of mental disorders typically rely on mental health professionals' judgment and patients' self-report data. As a result, such a diagnostic system may not accurately capture the physiological deficits and symptom progression to provide appropriate therapeutic interventions. This study actually highlights multiple existing challenges in making DL algorithms. However, it is promising for the future later. This is another study. Deep learning encodes robust, discriminate neuroimaging representations to outperform standard machine learning. Burada machine learning, burada da deep learning, multiple data, extraction, birleştiriyor data, iyi bir sonuç çıkartıyor bizim için. O yüzden üstünde, machine learning'den daha üstünde. Buradaki araştırma, yine güzel bir araştırma. Diagnosing schizophrenia using deep learning, novel interpretation approaches and multi-site validation. Multi. Burada Brain Research çok önemli bir dergi. Burada da leave one center out, 9 different global centers to train and test 3D ResNet models, generalizability, 82% classification performance on datasets sourced from different countries, marked differences in thalamus, pallidum, inferior frontal gyrus between individuals with schizophrenia and healthy controls. Aslında biz anatomiyi araştırmıyorduk. Ama deep learning kullanarak
actually we were not researching the anatomy, but we are learning the anatomy by using the deep learning. And
interpretations of different brain regions. Yine aynı benzer araştırma. Staging yapıyor, birleştiriyor ve iyi bir sonuç veriyor. Ama tabii ki neuroimaging ve şizofrenia için. Deep learning encodes robust, discriminative. Okay, bunu yaptık galiba değil mi? Tamam. Şimdi burada da yine going deep into schizophrenia with artificial intelligence in schizophrenia research. Burada şöyle bir ilginç bir şey var. Çok hoşuma gitti aslında bakarken. Burada bir portakal.
I learned something very interesting. The speaker is speaking away from the microphone. The interpreter's not. Konuşmacı mikrofondan uzak konuşuyor. The same oranges but single different color.
Ama bunu machine learning uygulasak bunu yapamıyoruz.
I mean, overall, deep learning is more powerful than the machine learning.
The accuracy of automatic data-based diagnosis and outcome prediction system is higher than ever. Yani ben deep learning seviyorum. Deep learning de anlatıyorum.
Like deep learning, I support deep learning here. Other researchers are saying that the
diagnosis of schizophrenia, achievements made by Chinese scholars around the past decade, advances and clinical implications of neuroanatomical biomarkers in schizophrenia by optimizing brain tissue segmentation. O zaman brain tissue segmentation kullanıyorsak yine bize ne verecek? Beyin ilgili bilgi verecek bize. Bu da çok önemli. Anatomi ilgili bilgi verecek bize. Evet, burada benzer genome, transcriptome, proteome, method imaging, ECG.
These are the similar genome. They are talking about the genome, transcriptome, proton, methylome, etc. They use feature extraction algorithms. It is used very much in the healthcare deep learning model. And there is also the deep learning research in psychiatry, geriatric depression and anxiety screening via deep learning using activity tracking and sleep data. And this study achieved significant results in the multi-label depression and anxiety.
By applying a mixed input DL model based on activity tracking data, the comparison of hyperparameter performance and the development of various DL models such as CNN, LCTM, and ResNet contributed to the optimization of time series data processing and achievement of meaningful results. Yine anxiety ve depression using the cat swarm optimization, deep learning, yine
Again, combining the deep learning and psychiatry, again, very successful results. So, toward molecular diagnosis of major depressive disorder by plasma peptides using a deep learning approach.
peptides using the gradient-based feature importance method to interpret crucial features, identifying 28 different peptides. Here I want to mention molecular biology, not only image studies, but also molecular diagnosis of psychiatric disorders with deep learning. Burada tablolar görüyorsunuz. SMC, ilk baştaki slide anlatmıştım. LSTM, Transformer ve ResNet. Daha accurate, area under the curve, daha anlamlı. Ama bunu tam tersi machine learning kullan, alamazsın böyle bir sonuç. Now, deep learning models for diagnosis of schizophrenia using EEG signals, a systematic review of EEG-based automated schizophrenia classification, a novel approach to schizophrenia detection, rest-dance fusion, and unraveling schizophrenia. Here using EEG signals. And what do we have? We have the EEG data there. And then we have the wavelet transform images. This is compressed. This is combined with convolution neural network and into easy medium, and then we have the results, extraction, multiple, and more detailed than the other studies. Again, detection of bipolar disorder and schizophrenia employing Bayesian optimized grade-cam driven deep learning. Here, combining ResNet, images, contraction, extraction, deep learning, results, and very, very important, and good results. Brain structural connectomy topology predicts medication response in youth with bipolar disorder. Şimdi, bipolar ve PTSD girdiğiniz zaman internette deep learning çok bir araştırma çıkmıyor. En çok fazla 100 kişilik bir araştırma, connectomy, topografi araştırma, tek bu. Yani bu ne demek? Daha çok deep learning, PT.
This means lots of bipolar and DPT research needed, and this is more machine learning in bipolar disease.
Learning for bipolar, connectomy, modularity, co-periphery, brain regions, edge connection gibi. Speech-based suicidal risk recognition for crisis intervention hotlines using explainable multitask learning, and analysis of the data set demonstrated gender differences in callers, with male callers speaking more in crisis calls compared to females. Bu araştırma, call center'da yapılan bir araştırma, crisis sırasında.
This is actually done through a crisis when they have suicidal effects. So who is calling, who is looking out for aid? A study again uses deep learning, and majority of the case is the male. So this is the result of the study. This is a very good study.
Data and feature visualization of the model also demonstrated the validity of the method. Yine deep learning. Speech-based suicide risk recognition for crisis using hotlines, önceki araştırma, callers, extraction, combining neural network ve solution. Şimdi, predicting childhood and adolescent attention deficit hyperactivity disorder onset, a nationwide deep learning approach, molecular psychiatry. Here, a DNN model predicting childhood and adolescent ADHD trained exclusively on Swedish registered data achieved good demonstration. If replicated and validated in an external sample, and proven to be cost-effective, this model could be used to alert clinicians to individuals who ought to be screened for ADHD and to aid clinicians' decision-making with the goal of decreasing misdiagnosis. However, further studies with different populations is necessary. Burada yine bir tane daha, early attention deficit hyper... Çocuk ve ergen psikiyatristler bizim gibi çok önemli. Neuro DCT-ICA, renal fish optimization, algorithm-based, optimized ADHD net. Bu da Nature'da yayınlandı. Daha yeni yayınlanmış bir araştırma. Çok da değerli bir araştırma. Then again, temporal normalization and brain image analysis for early stage prediction of attention deficit hyperactivity disorder. EEG microstates in the study of attention deficit disorder. Identification of diagnostic and therapeutic biomarkers for ADHD. Deep learning, şizofreni ve ADHD. En çok araştırma, en çok değerli araştırma, en çok
a very much validity and a lot of significancy. Why?
Early diagnosis of autism, a review of video-based motion analysis and deep learning techniques. Yine Çin'de yapılan bir araştırma, çok değerli bir araştırma. Burada gördüğünüz
Here you can see the inputs. The table show us that there is a suspicion for autism. Here you can have the videos. For some videos are filmed from 1 to 3, 5. So the data is collected. Deep learning is used. This is a great study. There are a lot of data, great data, and multi-site combination. Again, a very successful result that we can encounter here. This, as you can see.
Approach to predict autism spectrum disorder, a systematic review and meta-analysis. Yine çok değerli bir araştırma. Şu kadar.
Again, a very important study. So this is the data collected, and there is 11 articles. This is the final result, and meta-analysis is used on these articles. So again, very valuable. Again, another study for autism, again, concluded in China, a very good study, but this is not such a large-scale study. Again, image is used, autism and brain imaging, ABIT 1 and ABIT 2 is used. Deep learning neurons used.
Features to train several traditional machine learning algorithms, benchmark. Finally, we combine DNA with deep learning and AE and train it with new features which achieves the classification accuracy, AMA, area or under the curve is 82.4. These results show us that our proposed deep learning methods outperform the state-of-the-art methods. Yine deep learning, autism, ABD1, ABD2, contraction, fusion, extraction, sonuç. İlk başta ki
in the slides that I previously mentioned for the PTSD and bipolar disorder, when we look at it, there is no much thing that comes up. So we should have more research, but why it is lacking? So what is the reason? because deep learning needs to be multiple, there will be more significance. Multiple data, multiple variation should be there, and big data. There is big data, so this is difficult because the collecting data from different centers is very difficult. But of course, research is still ongoing on that as well. With regards to the substance using abuse prediction using artificial intelligence techniques, you can see that there are a lot of studies that we can encounter. As a last thing, there is this last study about
Danish nationwide register and genetic data. Bu da multiple site, multiple countries, control ve burada birçok araştırma görüyoruz. Yine burada
there are a lot of researchers, and it actually shows that schizophrenia, ADHD, depression, anxiety. As a conclusion, let's come to the conclusion.
especially in neuroimaging studies, the fact that psychiatry involves doctor-patient and questionnaire diagnosis is a disadvantage, and the black box effect. Neuronslar burada. Ama burada
We have neurons here, but we don't know what the result will be. So as a summary,
machine, subfield, deep learning çok değerli ama nerede değerli? Neuroimaging.
neuroimaging, fMRI, which diagnoses schizophrenia, and then ADHD. So what is the problem? Black box is the problem. What is the other problem? Us as psychiatrists, we are using as a tool. We are using scales. Everybody's scale is different. Everybody's evaluation is different. So this is a disadvantage. The other disadvantage is the big data. For him, big data is big for whomever, and so it is very difficult to find the big data. But again, I like deep learning. I can say that I am opting for deep learning, and for this opportunity, I would like to thank you, Mr. Azad, for this opportunity. Thank you very much.